For our campaign launch here at Orange, I'm Matt, I'm the President of the Orange Base Association. Today we're going to have a rundown of what the ratios are, going to get some experienced people to talk about their experiences. We've got Judith Kendra as a special guest speaker over here to my left. She's going to she's the Assistant General Secretary of the Nurses and Midwives Association. We've also got Fiona Rossiter, Mark Tyler, Lily and Boo, and a couple of guest speakers around the hospital who are actually going to explain what ratios mean to them and how the improved ratios will help them. I'll just hand over to Fiona Rossiter first up.
Thanks, Matt. Hello everyone and welcome here today. I've been asked to speak here as a health professional, and also I'll be honest with you, as a lead Senate candidate with Family First. I'd like to work with an analogy to give you an example of the impact on nurse-patient workload. So let's use a set of scales. I need a volunteer. Yeah, I've got a little volunteer here. Come in. Okay. So I want you to put your hands out like you're a scale. Right side is health professionals, left side is community environment. Okay, so this is the balance of the scale. So we're going to start with the health professionals. Limited staff, we've got sick leave. So that puts a bit more pressure on when they can't fill those spaces. So our health professional side is weighing down. A fast turnaround of patients, heavy workload of procedures, more and more of that's occurring. Frustration and lack of parking, which we have here, that's not for all health services, but sometimes there's a decision to go home rather than work. So therefore further impacting with nurse load. Patient flows increased due to more services available. Now this is a big tick for the Western New South Wales, the country areas, but with that comes increased workloads. Okay, community environment, so he's weighing down a little bit here. Community environment on this side. Government giving monetary incentives for people to move from the city to the bush. So we've got a little bit of weight going on this side here. More people coming in. Infrastructure here staying the same for the health service. We're going to encourage people who arrive from other countries to live in country New South Wales. Again, a little bit more weight on this side. Promotion of tourism, Evo cities, encouraging people to visit and enjoy the country lifestyle, hopefully settling into the country. Little bit more weight on the community side. Encourage skilled nurses to come back into the workforce, but, big but, these nurses will have to pay a financial and time commitment cost to update those skills. So, a bit of an imbalance again on this side for the nurses. Insufficient doctors, which we hear about, CSU lobbying, doctors for the bush. So again, there's a discrepancy with the weight on this side. More people from surrounding areas use the base hospital services because of specialty services, radiotherapy. This is a big tick, this is good stuff, but it's weighing down just a little bit heavier on this side. Smaller towns have had their health services taken away or downsized, putting more pressure on the larger hospitals. Limited services available to smaller, rural and regional health services. Again, a shift workload to major health services. So down you go. That's it. Bed block. Patient care is shifting. I believe this is dangerous, a dangerous measure. No significant input from government with this perspective, from what I've heard to date. Primary healthcare budget minimal, therefore insufficient money available to promote health education to the public. You can see the imbalance here. You can see how heavy the community is, and the nursing patient, the nurse health professional side hasn't changed at all. So there's a huge influx of people, and we're proud of that. We're proud of that we're getting these extra services here. But we have no difference here with support for health professionals, in particular nurses. They carry the major workload within the hospital infrastructure. The issue we have here now is that health professionals, in particular nursing staff, do not have the support and work conditions that are needed. You can pop your arms down the door. That are needed to provide quality health care to patients. Therefore, burnout occurs and patient care diminishes. There needs to be a significant change with the government's mindset. Like myself, I walk the floor and I get my hands dirty. I understand the impact that insufficient nurse-patient ratios are having on public and health professionals at this time. and to finalise the true perspective on how out of touch our government is, I'll give you one final comparison. If this was a small business that we were talking about today, there would be accountability. There are a set of regulations in place for small businesses that need to be adhered to. Otherwise, fines occur. Accountability. There are expected staff work conditions that need to be adhered to. Otherwise, Fair Work comes in. Accountability. Whether you look at the balance in the health workforce or on the wider scale, and I use small business as an example, the balance of accountability to the wider community, one thing sticks out like a sore thumb, and that is that the government, as we know it today, doesn't have their finger on the pulse. Therefore, nurse-patient safety is jeopardised. My job as a Family First candidate is to support nurse-patient ratio. I'm very proud to be here today and put patient safety first.